Hello everyone. This presentation's focus will be on seclusion and restraints. There are three different types of restraints. Physical is the most frequently used type and is an intervention or device that prevents the patient from moving freely or restricts normal access to the patient's own body. Chemical restraints are the use of medication in order to restrict the movements and actions of patients. And last is seclusion. Seclusion is the involuntary confinement of an individual alone in a room or area from which they are physically prevented from leaving until he or she calms down. Restraints began in the late 18th century in psychiatric hospitals in France. The purpose was to keep everyone, including the patients, safe. Due to the controversial nature of these techniques, groups created movements to try and stop them. One in particular occurred in England, where a former seaman named James Norris spent 10 years shackled to his bed with an iron harness. When released, he led the reformers to push for restraints to, in most cases, never be used. The British believed that a well-run facility with trained staff should rarely need to use these techniques. However, these continued to be used in other countries at this time. One of the main reasons with that these techniques were overused and abused. In an article titled Harm Without Recourse, the author discusses two main situations, although there are many more out there in school settings that brought on national attention. Cindy was a girl with autism that was restrained 44 times for minor issues such as throwing objects off her desk. The restraints being used were physical. She was being physically managed on average for 22 minutes on the floor. The second incident included a second grader named Tracy, who was also discussed and had a multitude of psychological and neurological conditions. She was secluded 10 times in 4 weeks in a closed-door room. Of course, when news of the situation occurred, people wanted to know more and raise awareness. This is where guidelines need to be addressed. If following the proper training techniques, de-escalation in particular, these situations should have never occurred in the first place. Some laws have been passed in order to try and regulate the use of these techniques. Keeping All Students Safe Act was a bill that prevents staff from using these restrictive measures as a form of discipline or punishment. However, it stated only that when children were in imminent danger. However, without guidelines of what is considered imminent danger, this did not completely solve the problem. The Children's Health Act regulated the use of restraints in federally funded hospitals and facilities. However, no laws were passed with public schools. IDEA, Individuals with Disability Education Act, states that students with disabilities still have a right to free and appropriate public education. However, many court cases have been dismissed regarding these techniques. Under IDEA, if a child with a disability requires the use of these techniques, an FBA should be conducted and a formalized behavior plan should be implemented. In 2009, Secretary of Education Arne Duncan sent a letter to school officials about the use of these techniques in school settings. He requested that states review its current policies and guidelines, and that parents should be aware of these policies as well as staff so that they can be implemented properly. And he also recommended a PBIS system. In the field of behavior analysts, ethical dilemmas can arise due to our clients. If we are in a situation in which we think our colleagues use physical management when it was not deemed necessary, then it is our responsibility to defend our clients and their needs. This may not put us as professionals in the best light, but we cannot think about other professionals over our own clients. Another ethical dilemma could be moving forward to a behavior intervention plans. Students with disabilities who exhibit some of these behaviors that result in restraints or seclusion shall be evaluated with a functional behavior assessment, and a plan should be implemented. Today's school staff should all be aware of these laws and make the best decision for the student/clients. Staff should have a better understanding of emergency situations and provisions for students with disabilities. And administration should be aware of any and all incidences to make sure steps are taken properly. One of the main issues in all the research was a lack of consistency amongst the states. Some states have policies and guidelines which others do not. Some require staff to be held accountable by requiring them to write up reports on each incident. Some schools have required trainings, while still others do not. These type of inconsistencies lead to the continued issues we have today. Although the recommendations of the Council for Exceptional Children push for more federal guidance, time limits, preventative measures, and state reporting, there is an increased risk that these techniques will not be utilized properly without better guidance. Preventative measures should be taken as well. Support should be provided by trained professionals in the area of behavioral support, such as BCBA, social workers, school psychologists, and special education teacher for students in a school setting. Data should be analyzed often, and de-escalation should be taught to all staff that will be working with the student. Teachers should be trained on how to praise the appropriate behaviors, i.e. a positive behavior intervention system, PBIS. And refreshers should be done more often. Typically, the training is 3 days long, but refreshers are less than 3 hours. All people that are trained in any of these techniques should really spend a day in their shoes. That means most training programs should require trainees to experience what it's like for the individual before being able to implement it on somebody else. This helps them to understand what the individual could be feeling at the time. In one particular study, participants were asked to spend time in a secluded room. During this time, they were asked a series of questions to discuss how they were feeling throughout. It was reported that people started feeling anxious and frustrated while being secluded. This helps for you to have some kind of understanding of what the clients or students are going through. Overall, these techniques should be utilized for the safety of all individuals, including the client or students, and the staff. Guidelines need to be given to everyone who is trained. Training should be done more often and with the same team members. All staff should be trained in de-escalation. De-escalation is a way to prevent the need for any of these restraints. And federal guidelines need to happen, or involvement by the federal government, so that all states are on the same page, so that there's consistency amongst the states. And follow-up should be done to hold people accountable. These techniques can be used appropriately if trained professionals are the ones using it.